Good morning and good afternoon, everyone. So I am Elsa Léger. I am the Global Science Officer of the PREZODE initiative. It is a great pleasure to welcome you to the second PREZODE panel discussion webinar today, which will address the definition and assessment prospects of prevention. Today, Professor Wim van der Pol will moderate the discussion. Wim is a senior scientist and a special professor of emerging and zoonotic viruses at Wageningen University and Research in the Netherlands, and he is a PREZODE steering committee member. Wim is also a diplomate at the European College of Veterinary Microbiology and coordinator of the Epizone European Research Group, the largest network on epizootic animal diseases research. And he's also actively involved in the ERASE program at Riviere, in which health disciplines work together on pandemic preparedness. You will have during this webinar the opportunity to ask a question if you want in the chat box on Zoom. And I wish you fruitful exchanges, and I'll now leave the floor to Wim.
Thank you very much, Elsa, for introducing me. Well, following the coronavirus pandemic, the PREZODE initiative was started to better cope with emerging zoonosis, because after the coronavirus pandemic, it was concluded that we should be better prepared for emerging zoonosis. Public health organizations tend to primarily focus on controlling emerging zoonosis, but looking at the global changes, wouldn't it be better to do more on prevention of pandemics rather than responding to outbreaks? What will it take for the world, for world leaders, countries, organizations, and communities to understand that prevention is very important, and how should we organize and communicate this? So good to organize this webinar to discuss prevention of emerging zoonosis. What lies behind the concept of prevention is our central question. And to discuss that in broader sense, we have four panelists, which I'm happy to introduce to you. First is Dr. Barton Behravesh. I hope I pronounced that right. Welcome. She is director of the One Health Office of the Centers for Disease Control and Prevention, and member of the One Health High-Level Experts Panel. Second one, Dr. Ana Riviere Cinnamon, Pan American Health Organization, World Health Organization representative in Panama. Welcome, Ana. Next one, Dr. Osman, consultant physician in global health, UK Health Security Agency and director, One Health Project Center on Global Health Security, Chatham House. Welcome, Osman. And the last one, Dr. Daniel Masiga, principal research scientist and head of the Human and Animal Health team at the International Center for Insect Physiology and Ecology, ICIPE, in Africa. Welcome, Daniel. Welcome to all panelists. What we'll try to do is to start discussing prevention, starting off with the definition of prevention, later on evaluation of our activities on prevention, and in the end also an open discussion about sustainability and other aspects that may arise during the discussions. To start off on the discussions on prevention, I think it's very good to start with the definition of prevention. I think it will be good to make sure that we know what our guest panelists see as prevention. So let's shortly exchange how we define prevention. And I would like to ask the panelists, according to your expertise and perspective, what is your definition of prevention in just a few words? And I would like to start with Casey. Casey, please.
Sure. So to be as simple as possible, prevention means to keep something bad in check or to stop a problem from happening in the first place. That can apply to a crime, a disaster, or a disease. And in the context of preventing the emergence of zoonotic diseases, if we can get ahead of the curve and stop a disease from emerging in the first place, we can stop an outbreak or even a pandemic, and that will help us better protect human and animal lives and the environment.
Thank you. That was very clear. And the second one, I would like to ask Anna, how do you see prevention?
Hi, I do see prevention in the same ways as Casey has mentioned. And I think one of the key words in here is being ahead before everything happens. And for that, you need to have certain criteria and certain indicators in order to be able to identify what is going to be, what's going to happen, predictors. So I think that's how I would add to the definition of cases.
Okay, thank you. So a main issue is finding predictors or knowing predictors, seeing predictors. Thank you. Next, Osman, how do you see this? I can't hear you, Osman. Maybe you're muted.
Yeah, hi everyone. Sorry,
Okay,
I
thank you.
was on mute. I of course agree with Casey and Anna, but I'd perhaps add a little bit of detail. I think it's important to make the distinction between primary prevention and secondary prevention, and also to state that when it comes to health, that you have what we call the wider determinants of health. So these are the biological, social, and ecological drivers that have an impact on health and human health outcomes. So in relation to that, then primary prevention relates to all the interventions that you can put into place to address those different drivers of poor health and prevent disease even happening in the human population. And then secondary prevention is that when disease has happened, how you best contain it, mitigate it, and minimize its harmful effects. So for the individual, that means early diagnosis and early treatment to minimize the impact or the harmful effects of the disease. And for a population, that means limiting the spread of the disease to other members of the population.
Yes, thank you. So secondary prevention is actually very close to controlling diseases. Thank you. And Daniel, how do you look at prevention? Please take the floor.
Thank you, Wim. So, I mean, when I look at zoonosis, for example, prevention is stopping pathogens from spilling over from animals to humans. And one would look at, I mean, that would also depend on a number of things. What pathogen is it? Is a spillover from livestock or is it from wildlife? So the measures that we operationalize to stop that spillover is prevention, is part of prevention. Yeah,
yes,
thank you.
So that would mean that part of your prevention activities is also investigating what you need to prevent for and what would be the best, let's say, control points for or action points for prevention.
Exactly. Yeah.
I'm glad that panelists seem to be agreeing on prevention quite clearly, so that's good. Yes, here is some text on prevention of this is the high-level expert definition. Prevention includes addressing drivers of emerging disease, namely ecological, meteorological, and anthropogenic factors and activities that increase spillover risk in order to reduce the risk of human infection. Casey, could you explain, Casey and Osman, or first Casey, could you explain how this definition was built by the panel?
Sure. So the One Health High Level Expert Panel, we're talking about how to better prepare for and safeguard against the next pandemic, and recognizing that the term prevention has been used differently in different contexts. It was essential to define prevention in the context of spillover for preventing outbreaks, endemicity of diseases, epidemics, and pandemics, so we could ensure alignment with prioritization of actions and resources. So looking at zoonotic spillover of pathogens from animals to people, that being recognized as the predominant cause of emerging infectious diseases and the primary cause of several recent pandemics, the OHHLEP got to work to increase awareness of the need for this enhanced prevention of zoonotic spillover within the context of pandemic prevention, preparedness, and response, and put together the definition that was shown on the screen to incorporate a One Health approach and highlight how we urgently needed to most effectively work together to understand how to prevent the next pandemic.
Okay, thank you, Casey. Do the other panelists have well, something to add to this definition, or do they have ideas about this definition that they would like to share with us? Or do people agree with this definition? I think it's, to me, it looks like a very workable definition. So thanks to the high-level expert panel to make this definition. If there are no comments, I would like to proceed. Prevention is stated in PREZODE as the most cost-efficient way to avoid pandemics. What activities does the term encompass, and what scope of action does it cover? This is open for discussion. Do people see important actions or activities associated with prevention that we need to work on harder, or need to put more effort in as it comes to prevention, in your opinion?
So I'm happy to start off.
Okay, go ahead.
It's very important to have a One Health approach for prevention. There's no single person, organization, or sector that can tackle prevention alone. And if we want to be successful, we have to apply the One Health approach and involve all the relevant partners as a foundation of our work.
Yes, and are there some interesting, Anna, would you like to add something?
Yes, I just would like to add that when we talk about prevention through a One Health approach, what we also need to think is the way in which we would finance that prevention. First of all, it needs to be structured. We need to clearly understand what we need, what we define as prevention, but then we need to understand how we will be funding the costs of that prevention. And that would depend on very different types of levels of funding, which can come from national sources up to international level. But I think what's important is to ground a little bit more these concept of prevention through a One Health approach, because it's not that simple, since, as Cassie was mentioning, it goes through different sectors. And when we talk about different sectors, we talk about different sources of financing and different allocation of funds, which are not always compatible with working through the sectors. So that's one of the main factors that I would like to highlight.
Yes, thank you. I clearly understand. Thank you for adding this. I see some more hands. First, Osman.
Yeah, I was gonna just build on what Anna's saying, and I think that's why it's so important that part of what we think about when we're I mean, when it comes to this prevention dimension or this prevention element, the human animal environmental interaction is what's really important to understand. So what is bringing them into closer contact with each other? What are the societal factors that are causing that increased competition, increased risky behavior, increased risky interaction between humans, animals, wildlife, and the ecosystem that they're within? And then that's where you can then start to make a distinction between what you might consider sort of upstream prevention versus downstream. So the proximal event that causes the spillover versus, you know, what it is that might be a human endeavor, say, for example, around intensifying agricultural production nationally. That might be the human endeavor upstream, but the downstream effect is that you then have like these intensified systems with poor biosecurity, poor biosafety standards, and then a spillover event because of, you know, inadequate IPC or whatever within the agricultural sector. But the upstream human activity was the desire to intensify or increase that agricultural production. So at what point within the life cycle of that product or that pathogen or that population behavior do we intervene to prevent the eventual outcome, which is the eventual negative outcome, which is the spillover event itself. And that's where you can use things like environmental impact assessment when it's a big industrial project, health impact assessment where it's a big again public sector project, where you can use things like hazard analysis and critical point analysis to look at the entire life cycle of not just a pathogen but an industry or a product, and understand these are the risk points where we can intervene, or where we're significantly increasing the risk of a spillover event occurring, and then design interventions around that.
Yeah, thank you. So this would mean that we really need research to assess or to increase our understanding of the transmission routes, and also assess the risks, and use that information to incorporate our prevention activities. Thank you. Daniel, you also would like to add something. Please go ahead.
Yeah, just, when you look at a pandemic like COVID-19 emerged from somewhere, but you could have pathogens of pandemic potentially emerging from multiple places. So you have to look at, for prevention to be effective, we really do need in-country capacity development. And you have to think of the last mile as the first mile, and so you strengthen systems at that point to not only recognize the potential of something emerging, but also to deal with it at that point to prevent it from spreading. So in-country capacity in terms of human capacity, but also systems that can be operationalized. So when, for example, you have fevers of unknown etiology at a primary healthcare facility, what do you do with it? Does the patient just go away, or do you escalate that so that it's further investigated? So I think prevention requires a lot of capacity building, a lot of information sharing, a lot of data sharing, and trying to make operationalization as cost effective as possible at the last mile. And the last mile is also the first mile. So we have to look at it from a bottom up and also at both national and the local level. Yeah, thank you.
Thank you, Daniel. In the chat, I also see the remark that prevention also, we need also to consider community engagements. That sort of adds what Daniel is saying. And I also see a remark, prevention needs to take into account hazards and risk, cost efficiency, trade-offs, but caution about precautionary principle. Is preparedness part of prevention? Yeah, that's a question. Is preparedness part of prevention, or is Yes, I would say that these sort of overlap, prevention and preparedness. I think your prevention activities should be, I guess, part of your preparedness. How do our panelists look at that relationship to preparedness? Any remarks about that? Is it part of preparedness? Is your prevention activity part of preparedness?
Wim, if I may respond to that, I think Osman talked about secondary prevention.
Yes.
And that's how do you respond once an event has started. When you think about the COVID-19 response, vaccine production was only possible because there was preparedness. So the technology was in place to develop those vaccines as quickly as it was done. So I think preparedness is part of prevention. Yeah.
Okay, so that's one example. Do people, well, Casey?
Yeah, prevention and preparedness are definitely linked. As we just heard from Daniel, that's a really important piece. And in order to help with both prevention and preparedness, we need a strong and trained workforce, and also cross trainings with people from different sectors as part of the workforce to help with all of our prevention, preparedness, and response needs. So I just wanted to add that point as well.
Thank you, Casey. Anna, you would like to add something?
Yes, I just wanted to mention that, of course, these two concepts are very much interlinked, but you won't be able to prevent anything if you are not prepared to it. So you need to have a different type of analysis, identifying what would be the most likely, let's say, disease coming, and try to prepare for that thing to come. It's very easy to say, much more complicated to do, but I do think that's how it's linked.
Yes, that was already, yes, thank you. It's clear that we need to have good knowledge of what's really happening in circulation of pathogens and spillover of pathogens to, well, to make good prevention measures. Osman, would you like to add something?
Yeah, I mean, I think there is a lot of overlap, but I think it is important that we clarify the distinction around prevention of spillover, because what's happening is that a lot of the preparedness investment then just goes into the human health sector, and we're not putting enough financing or support into the animal health sector or the environmental, the ecosystem sector to prevent that spillover event happening in the first place, right? And therein lies a problem, whether it's the pandemic fund or what's being negotiated through the pandemic accord. Well, the pandemic accord, for example, when it relates to countermeasures around diagnostics, vaccines, and therapeutics, it's only talking about that in the human health sector. So if you came up with some amazing vaccine that would stop the spillover event, but meant that that it's an animal vaccine, for example, that wouldn't be covered by it. Or you wouldn't look at diagnostics within the animal sector or within the part of the life cycle of the pathogen that is perhaps in the ecosystem or the environment. And therein sort of lies the problem. And I think that's why it's important that when you think about prevention, we're thinking about it before the spillover event takes place, and what investments are needed on that side, because the difference in investment in the human health sector versus animal health or environment is tens of folds a magnitude in difference, right? So there's no comparison in how much money goes into each of these sectors, and I think that's important to remember.
Yes, and it's well, you can make prevention measurements all along the chain of transmission. And I agree that it's really important to at least make sure that you try to prevent from the basis. So that's more focus on primary prevention then. Yeah. Anna?
Yes, thank you. I just wanted to add to what Osman was just mentioning, and it's something that we tend to forget. We always think and we always talk about funding healthcare systems and make them strong and resilient, but nobody talks about how to improve animal health systems and veterinary services in country. If you don't have the strong surveillance and strong capacities at country level to identify what is happening, it's going to be very difficult to identify anything that can come, for example, from wildlife or from animal production. Besides the fact that you do also have some private interests interlinked to releasing information about what circulates in intensive animal production. But we never think and we never focus on how to fund those systems and how to make them more strong. And I think that's the basis to have prevention. If we don't have good capacities at the animal health system level, it's going to be very difficult to identify what circulates in the animal health sector independently, whether it's intensive production or backyard production or wildlife. Over.
Yes, I fully understand what you mean. In the veterinary health sector, controlling measurements are mainly focused on animal diseases and not so much on zoonosis. And if we cannot make that work also in the veterinary field to have more attention for zoonosis, prevention of zoonosis, it's probably very difficult to have these measurements, these prevention measurements in place from the very basis. Are there other remarks or what people would like to say about prevention activities, definition of prevention? I think we had a nice discussion. Catherine, please.
Yes, thank you, Vin. I was thinking maybe we could ask if we can observe prevention activities on the field and how to evaluate prevention efficiency, and maybe Daniel could answer that.
Yeah, Anna, sorry, Catherine, maybe I just pick up from the conversation of Anna and Osman, you know. So it's difficult to value prevention when you do not see what you have prevented. So if you look at some, I mean, there are examples that show us that we can actually evaluate prevention in certain cases. So I think of Rift Valley fever virus, which is one of those mosquito-borne viruses that originated or were first detected in this region in the East African region. So RVF was detected in the 1930s in Kenya first, and it has been detected in other countries as well. And RVF is very linked to climatic events. So because the mosquitoes that are the primary vectors of RVF are associated with flood waters. And those are predictable events. So for example, in 2023 and 2024, the Kenya Meteorological Department issued flood warnings. And some regions, because Kenya is divided into counties, which are subnational administrations. So some regions vaccinated their livestock because RVF is fast. It's fast detectable in livestock before. By the time humans are showing up with it, livestock are already infected because the primary way that humans get this in high enough doses is by handling infected animals. So prevention can be achieved by vaccinating animals, and there's a really good RVF vaccine for animals. So Osman, this is one exception where there's a good vaccine for animals, but not for humans. And so prevention is possible at that stage. And it was seen that in the counties that did their vaccinations in 2023, 2024, did not experience outbreaks of RVF in humans. And those that did not were more likely to show cases in humans of RVF. I think also Kenya vaccinated in 2023, Uganda did not. And there were outbreaks in Uganda that were not experienced in Kenya. So that's one example. I could also refer to another disease now. Yellow fever, a vaccine for yellow fever virus has existed for more than 100 years. I think it was produced at Fiocruz more than a century ago. And so the vaccine is available. There are not enough doses to go around. And so vaccination is usually prioritized for when there's justifiable risk. And how do you measure justifiable risk? In 2023, there was an outbreak in Kenya with fatalities. And that was because it followed a period of prolonged drought. And animal pastoralists were forced to have closer interactions with sylvatic transmission, which occurs mainly in primates. So that's an event that could be predicted because drought led to those closer interactions, but vaccinations were not undertaken at a level that could have prevented the spillover from primates to humans. So in short, it's possible to evaluate, but it's really dependent on the disease system that we are talking about. Yeah, thank you.
So the Rift, thank you, Daniel. So the Rift Valley fever is really a good example where vaccination can be evaluated. Do people know, other panelists, other interesting examples of evaluation, or maybe shortage of evaluation? I agree it's very important to try to evaluate our prevention measurements, because by showing that we can, by doing that, we can show that it has good results. I think the Rift Valley fever example is very interesting. Maybe people know other examples that would be nice to hear. If not, do people know, other panelists, how can we evaluate and monitor prevention activities that we are incorporating? Do we have ideas on that? Casey, do you know what evaluation activities are done or are started in prevention measurements?
With all of our work, monitoring and evaluation is very important to track progress and show value and help inform future plans as well as policies. So that is also something that's highly relevant to prevention.
Okay, thank you. Another important question is, can we provide data on a return on investment to donors and funding agencies regarding prevention? If we can we show that it works, that they have good value for their money when they're putting money in prevention activities? Do we know examples of that? Anna, do you have an idea on that? You discussed, you made a statement about funding that was very interesting.
Yes, thanks for the question. Yes, indeed, that's always the conundrum of trying to identify the most cost-effective activity in order to prevent. That really depends on how we define costs and how we define effectiveness or benefits in that sense. And there's a lot of controversy in the different types of methodologies that can be used to do that, especially when we talk about avoiding deaths, human deaths, because that means that you have to stick cost to human life. So, so there are many different types of options through which you could evaluate that. But if what we are doing is trying to prevent deaths, I think prevention will always outweigh the costs of human death. Having said that, there are activities that can be done, of course, with a cost that might help avoiding a certain number of deaths, human deaths. But as it was mentioned before by Dr. Masiga, it's always difficult to evaluate the cost of prevention, because if you have been extremely successful, the event has not happened or will not happen. So you will always be criticized by having invested too much in prevention while there was no event. So it's as they say in the US, it's a catch-22. What we have to do, it's probably in my point of view, is to invest into activities that will have not only preventive benefits in terms of spillover, but for spillover or zoonotic diseases, that could be either like avoiding deforestation or trying to prevent diseases that come from the whole like food chain from farm to fork, that will have benefits on other areas, not only just on preventing human deaths. So, I mean, there are a lot of articles and quite a few studies done on costing those activities. There's one which I would recommend, done by the World Bank. It's a One Health business case done in 2022, where you have quite a list of good examples of how much could it be invested, for example, in terms of avoiding deforestation, and how much it needs to be invested per hectare, for example, at high risk forest areas where you know that there's a lot of zoonotic agents. But that would limit the number of spillovers and in human deaths, but it will also enhance biodiversity, which has other positive productive outcomes. On the other side, in this document, you have also quite a list of different types of studies done on the costs of preventing diseases that go through the food chain, either from either wildlife hunting that can jump from one continent to the other, or from farming, as we were mentioning before, intensive farming production or backyard, pig, poultry, ferrets, or even bovine. But definitely methodologies of evaluating costs vary a lot. It depends on what are the criteria that you use in the cost section and what are the criteria that you use in the effectiveness or the benefit side. And definitely that is something that has a lot of space for discussion, and that we could eventually at some point think about trying to identify the framework which we could use for evaluating those activities. But definitely that is a very rich discussion topic.
Yeah, thank you. Yeah, and well, it will also help probably to do more research on the parameters that are important for evaluating prevention. Do other panelists like to add something to this about how to evaluate prevention and looking into a return of investment of prevention? Osman?
Yeah, just to say a couple of things. I mean, there are of course the classic examples like dog rabies vaccination and Nipah virus control in Southeast Asia, which we know there's good evidence and there's good cost effectiveness analysis that's been done. But I think it's important to just lay out the process and the principles behind how this is done as well. So one is that you want to evaluate process, right? And with all of this, it's important to first set a baseline. So what is the baseline around cross-sectoral primary prevention activities within a country or within a setting? How is that being operationalized? So how are you measuring and monitoring the process of primary prevention strategies, say using a cross-sectoral One Health approach? Are you adhering to all the sort of principles of the One Health approach? Are you looking at issues around equity? Are you looking at inclusiveness? Are you looking to around issues of access to the most marginalized, vulnerable groups? Are you thinking about the socio-ecological equilibrium? Are you thinking about stewardship? Are you thinking about having a transdisciplinary approach? So everything related to process needs to be monitored and evaluated. Then there's the impact side of the evaluation, right? Are you evaluating outcomes across the three sectors: human health, animal health, environmental health? Are you looking at the economic benefits of the intervention? Are you looking at the net social value, net social capital that's being accrued? So what is your approach or methodology around co-benefit analysis? And then finally, there's the element of trade-offs, right? Anything that there's always opportunity cost. If you invest in one intervention, what other services are you compromising as a result of it? Because you have limited human capital, you have limited financial capital. what is the trade-off that's taken place by you investing in a particular intervention? That's the way you do a holistic, proper analysis of it. And really, at the start of that is that you have to always get good baselines done, particularly when you're trying to assess something like prevention, where you do have this issue with the prevention paradox. How do you measure something when you've prevented it? It's important to have a baseline. How many outbreaks have been occurring in the past? How many people have been dying of X, Y, or Z zoonotic disease in the past? So getting that baseline data is important before you benchmark any intervention.
Yeah, thank you. So that means also that we have to increase our knowledge on what is happening, and we also have to make sure to study what preventive measurements would encompass. What would be the positive effects, but there can be also negative effects of prevention activities that we have to look into also. Are there any other comments about evaluating and return of investment? And if not, I suggest we continue with the next part of the discussion, the sustainability. Future emerging disease prevention activities will have to be incorporated in sustainable agricultural production, not only environmentally sustainable, but also economically sustainable. And looking at global changes like climate change, the loss of biodiversity, and the growing world population. This looks like an important aspect to discuss also. How do we reconcile sustainability and economics regarding agricultural practice and livestock management? Daniel, could you say a few words about that?
Thank you, Wim. I think first maybe just give some context to this. So the current consumption of meat globally is about 350 million tons. In 2050, this is projected to rise up to about 570 million tons. That's an increase of about 50%. And the population, human population continues to rise. Production systems continue to get more intense. So, and including a huge amount of inputs, antibiotics, growth-related factors, and so on. And there is also the conflict between sources of animal feed that are also used as human feed. So fish stocks, for example, that go into poultry feeds that are also used for human feeds, for human food. And when we think about livestock, we also have to think about what production systems are we talking about. Is it livestock only, which is very common in temperate regions and maybe the tropical highlands? Are we talking about mixed agriculture where we have some crop production as well as livestock keeping, or some in the arid and semi-arid areas where it's, livestock are the sole source of livelihood. So, for example, and I'm giving this example because it's within the Eastern African context, which also is the source of a lot of emerging viruses, including things like Zika, West Nile, and so on. Somalia, for example, relies almost entirely on livestock. So 80% of the population relies on livestock for livelihood. 45% of GDP, national GDP, is from livestock. So when you think about Somalia having been unstable for the last 20 years, the last 5 years, they have exported 22 million heads of livestock. They're small ruminants, camels, cattle. So within that context, the production is still ongoing. Is it sustainable? I think we have to keep an eye on that because of emergence of antimicrobial resistance. which is very closely linked to livestock production systems. But we also have to look at alternatives. So for example, the environmental footprint for production of livestock is way more than other alternatives. So I know Vim's University and our institution are very strong on insects for food and feed. So and that's a sector that is not perhaps should have much more growth than there has been. So there are about 2,000 different insect species that are consumed globally, and yet people still want poultry and fish and cattle and so on. So I think sustainability is closely linked to rising population demands, and how do you deal with the demand without compromising the environmental footprint or compromising human health through misuse of antibiotics. I think Vim had asked other panelists to weigh in on this as well. Thank you.
Yes, thank you, Daniel. Yes, and this is of course very different for the different regions. So I'm happy to hear views of other panelists about sustainability of agricultural production. Who can I give the word about this point? Maybe the American situation, Casey? Sustainability of animal production. How do you look at that?
Sure. So with our efforts in the United States, we work closely across public health, agriculture, wildlife, and environment sectors to address challenges and issues that we're facing. It's no secret we're battling an outbreak of highly pathogenic avian influenza, H5N1 virus that's impacting cattle on dairy farms, poultry farms. Cats are involved, a number of wildlife species, and on occasion spill over to people who have close contact with those infected animals. So that's something we very much use a One Health approach to address and consider the full spectrum of needs relevant to sustainability and economics as well.
And do you see some changes in the animal production sector related to these kind of emerging infections, for example, in the cattle industry in this case?
Sure, we have a range of different levels of production of milk in the country through the larger scale farms, but also some of the smaller scale farms as well, and working with the industry partners to exchange information and address this problem is critically important.
Okay, thank you. Any other comments about this? Osman?
I was going to say that this is one of those shrug your shoulder kind of issues, because a lot of this is values based, and you know, our economic models in many of our countries is consumption driven economics, right? You only show success by increasing production, increasing consumption, and that's and we're reaching the sort of planetary boundaries around many of those kinds of industries, and agriculture is one of those. It's not just the food system, it's lots of other things within agriculture as well, right? I sometimes use this example. If you visiting a sick relative in your local hospital in the middle of December, you want to be able to take fresh flowers that have been grown in East Africa and flown the same day to the Netherlands and then distributed to wherever it is that you are. But you want to pay for that and do that. You don't want to use a local flower that might be there, or no flower, or some green plants. You have to use a fresh flower, long carnation, because you know your relative likes that. And it's the same with our food patterns. You know, what we were eating in Europe, what we eat today in terms of poultry consumption is vastly different from what we were just eating in the 1960s or the 1970s, just 40, 50 years ago. Within one generation, those consumption patterns have radically changed. And until we get a grip on that wider societal issue, have those wider societal conversations around what it is that we value and how much we ascribe to that, we're not going to, we're just tinkering around the edges in a sense. You know, we're not going to make the systematic changes that we need until we do that. So, you know, when we had mink outbreaks and whatever with COVID, it's because we value mink coats, right? We've ascribed an artificial value to that, which everybody somehow has.
Yeah, but it also
willing to pay vast amounts of money for these products, and you know.
Yeah, but I agree. But we also see from this kind of events that we are running into the boundaries. So that's also why, for example, in the Netherlands, we have stopped mink production because we think it's not ethical anymore and also dangerous in the case of COVID. And that's probably the same with other agricultural production, that we are running into boundaries of what is our environmentally acceptable. So I think that's indeed an important point. Do we have some other remarks about it? About this, I'm happy to hear other panelists about this also. I think it's an interesting point. If not, yeah, well, that's also one of the next question is, how do we bring together human and animal health for better prevention? That's also close to this point. How do we ensure well, the animal health sector and the human health sector, that they have to work together on prevention of emerging zoonosis? Can I ask that question to Osman?
Actually,
First?
if I just may step in, Wim, I'm very sorry, but
Yes.
if we can also add maybe environmental health, so to have, like, I would say, the complete One Health topic, and it's I think some points that have been raised also in the chat from the audience. If we can do, as you say, human health, animal health, but also environmental health here for better prevention, if I may, yeah, just add these little points if you want. Thank you.
Yes, I didn't really have time to look at the chat, but I see indeed that there is some mention about the environmental dimension of prevention. We didn't really discuss that yet. That's true. There are environmental drivers, and we should work on these also to stop spill or to prevent spillover of emerging pathogens. Casey.
Sure, thank you. And I'm glad to hear Elsa mention including the environment piece as well, because it's critical to have the public health sector, agriculture, wildlife, and environment really engaged in addressing prevention. And if we want to do that effectively, we have to build trust, we have to have transparency, we have to have shared priorities, and we need to work together to do this long before there's a crisis. It's very hard to build these types of relationships and build trust during a crisis situation. So on the animal health side, in addition to, you know, the livestock or agriculture sector, there have been more and more efforts with wildlife engagement, which is really great and important. For example, the World Organization for Animal Health has their wildlife health framework that is very relevant to the prevention discussion here. There's also some gaps around companion animals, going back to what we're seeing on our dairy farm situation in the United States. There's a lot of barn cats that are dying from H5N1, and often the cats are dying before cases in the cattle are being detected. That's something we can't ignore. That's something we need to pay attention to. So keeping that in mind. And then on the environment side as well, there's a wide range of partners on the environment side that are relevant to this. There are people working on air, soil, and water issues, but there are also people working on biodiversity and conservation issues and more that are very relevant here, including some of the you know, safe movement and trade of wildlife and some of those efforts as well. So for me, a bottom line answer into how to bring together people from human, animal, and environment sectors is to formalize your One Health coordination, have a platform where you get all the right players involved, work on some shared priorities and activities, and really work to make a stronger and coordinated system there. And I'll pause and let my other panelists add to that, but I might have more to say on this point. Thank you.
Yeah, thank you, Casey. Also, in the Netherlands, we also have some examples that show that it is important to get your One Health community together to make sure that when there is a problem arising, that you can work together to try to control the problem as soon as possible. If you start doing that when the problem is there, you're already very late. Anna, you would like to add something? Please go ahead.
Yes, no, definitely agree with what Casey just said. I do think that what we need to maybe work a little bit more on or give some thought is how we will structure surveillance in each of those sectors and how we will coordinate the sharing of information of the surveillance data between those sectors. And I mean indicator-based surveillance, event-based surveillance, and community surveillance. Depending on which sector we're talking about, we might have a stronger component of one of those types of surveillance, but that's the only way in which we will be able to have data that would allow us to take action. The thing is that we need to structure the way the information between these different types of surveillance system between sectors, let's say animal health, human health, and environmental health, would be interlinked, and the way that it will be coordinated. And I do think that the way that the coordination will have to be done is very much linked to, and we go back to one of the topics that we mentioned before, the way it is financed, how much funds there are, but how these funds make all these sectors work together and not compete between them. Because one of the issues we have now is that there's a lot of not sharing information for economic reasons or economic interests on one side, and on the other side, there is either no information because there's no funding, or if there is funding, there's not an incentive to share that information. So we need to think smartly about how we fund that surveillance with the One Health approach.
Okay, thank you. And do you think that there is also an important role there for the authorities, local and national, and maybe also international authorities to make sure that we stimulate these different sectors to work together?
Definitely. I mean, the funding of those systems has to come from different types of sources, either local, national, and even international. And you can even have, as we've seen also in the human health sector, it could come also from private insurance or national health insurances. So we need to find a structured way in which these funding structure would provide an incentive for these sectors to work together.
Yeah,
definitely.
Thank you. Are there any other ideas about this from other panelists? And maybe I can also raise how local communities are decisive to induce major changes. I guess they should be as much as involved as much as possible. We need also to probably change behavior, people, towards zoonosis and towards prevention activities. Yes, maybe Daniel, do you have some ideas about that? How to raise, for example, awareness, and how to get people involved, both locally and maybe also on a wider scale?
So now, if I just pick up from the previous discussion about human and animal health. So several countries now have One Health coordinating office that has human health, veterinary services, and environment authorities, the forestry people, and so on. But very often it's a coordinating office that is very responsive once events have taken place. So if there's an outbreak, then they respond jointly. But I think the cooperation needs to happen way before that. So that when we talk about prevention, it can be done in a more coordinated way rather than just one sector working separately. But in response to your question about communities specifically, again, I want to give an example of Aedes-borne viruses, so dengue virus. For example, in Kenya, we have the coastal region of Mombasa as a place where we have frequent activities of dengue, and that may be related to the fact that it's a port city and we have high density areas, so people are storing water in containers in which mosquitoes will breed and so on. So for management of those breeding sites, as an example, it's essential that the community are aware that they are at risk because of those containers. So the prevention activities have to start at that point, at household level, at community level, at national level, and so on. So I think it's, I mean, that example, dengue is just one, West Nile, transmitted by the same mosquitoes. So mosquitoes that are breeding very closely with the, especially in urban and peri-urban areas, the communities are essential for prevention activities to be successful. Thank you.
Thank you, Daniel. Is there any other, one of the other panelists would like to add something here? If not, I think it's time that we open the discussion for the wider people. I think we had interesting discussion on how to define prevention and how to try to evaluate our activities on prevention, and also look into costs of prevention, how we can discuss that, and also looking at sustainability of agricultural production related to prevention. Maybe I can ask Elsa and or Catherine to show or to pick some of the questions in the chat. I've seen that there are quite some questions in the chat, but I didn't have really time to look into them. Maybe you could rephrase some of these questions that are interesting for the panel to discuss, or to try to respond to. Can you do that?
Yeah, thank you, Wim. So I think there was a lot of points in the chat regarding, so we just discussed that, so maybe we can carry on that regarding community engagement. So thank you, Daniel, for like first responses. One of the questions where what could be the best practices for prevention through community engagement? What could be the actions, whether it is bottom-up actions or also like feeding back communities regarding prevention? I don't know, Osman, if you had any information on this or an answer regarding that.
So I mean, I suppose it's a no-brainer that community engagement is a key important aspect of this. But I think the trouble is that we don't actually engage with or consult communities in the design stage of these processes. So it's the decision's already been made that this is the priority or that's the priority, or a donor comes in and says, I want this to be the priority, that to be the priority, and then that's taken to the communities, and the community engagement aspect is done almost as a in a tokenistic manner, as an add-on, just to show that we did a bit of community engagement. And therein sort of lies the problem. And it's not just about sustainability of outcome. It's about, again, as I was sort of saying, sustainability of process. So if you really want communities engaged, if you really want the other sectors outside of human health, which is generally better resourced, animals and the environmental health sectors properly engaged, you have to look at their primary interests, or what they're concerned about, and what their the local issues are, right? And that's often lacking. And when we have done it, so for example, we ran a big cross-border national simulation exercise around One Health emergencies in across Kenya, Ethiopia, and Somalia. The communities come out with a different set of priorities, and it's important to note that those can be at variance sometimes with what external partners, funders, donors are interested in. So, for example, if you go to a community and try to say to them, you know, we really think you should be worried about AMR and resistant pathogens. To them, that sounds like quite a ridiculous notion if they don't even have access to antibiotics in the first place, or clean water and sanitation, and they're repeatedly getting infections because of entirely preventable issues. So for them, that's not the issue. You can still address AMR by addressing those upstream causes of AMR and perhaps increasing equitable access to an antimicrobial, but you're not but if your interest is to focus on surveillance of antimicrobial pathogens, for instance, you're not going to get much traction with the community, right? So it's always, in a sense, about first starting with what it is that those, whether the indigenous communities, vulnerable groups, marginalized groups, local communities actually want. What is their priority, and are they part of the governance mechanism or the decision-making process where things are prioritized and interventions are designed?
Yeah, thank you. Any other questions from the chat, Elsa or Catherine?
Thank you very much, Osman. It's really, really interesting. So there is another question from the chat coming about. So what is the current status of transdisciplinary modeling that could be used to justify primary prevention intervention? So something that would require integration of economics, social settings, biological, so is this thing being done currently, or is this even doable? So this is a question from Max Claron. So regarding this, all this transdisciplinary aspect. I don't know who wants to start first on this one.
Anna, please.
Anna, yes.
Yes, well, that's an excellent question about transdisciplinary modeling, or modeling that can encompass different types of sectors. Again, as mentioned, for other areas such as economic analysis, everything depends on how the model is set. But definitely there are groups which are working on trying to do ensemble modeling, where you have different types of models grouped together, where different variables are taken into account, such as, for example, climate variables mixed with entomological variables and virus modeling, in order to identify, for example, outbreaks of dengue or Zika or chikungunya. So these are things that are done and are very much, let's say, it's a value that we are working on, because that's you cannot simplify that much what's happening in real life. You need to identify all these other variables and these proxies that affect the occurrence of diseases. So technically, it's not easy to mix all those models. So we need to continue doing this kind of research. Of course, no model will be perfect, and no model will represent the reality perfectly. But the more tools we have which embrace this different type of modeling of different variables, the better tools we will have to decide or identify which actions we have to implement in the field before we have some kind of disease. Of course, it's not a crystal ball, and it's not going to tell us what's going to happen in the future, but it can give us thresholds of what are the probabilities of having some kind of spillover event of diseases that we know already exist. Of course, they are not going to identify diseases that are not there. so that we are able to implement the actions that can at least not that much prevent, but lower the health impact in human population and eventually in others.
Yeah, thank you. And well, also in the chat are a number of remarks about the importance of surveillance. So if you do that, you can also use that data to improve your models. So I think that could be helpful from both sides, modeling and surveillance, and combining that. How do others look at this modeling and surveillance? Are there any other comments about that? Maybe there are some other points.
Yeah,
that
if I may
are,
say,
Elsa?
and I know that, yeah, you're quite keen on surveillance indeed, and it's true that there was several remarks on the importance of early warning systems, for example. So how about early warning systems in the animal environmental health sector? What would be the best way to advocate the importance and relevance, and especially to non-technical stakeholders here?
Again, I'm taking the
Yes.
mic. I'm sorry. But
ahead.
yeah, I do insist on surveillance because of a simple thing. I mean, if we don't have data, we cannot do much. We need to know what is there. We need to know where it is. We need to know at which point in time it is there in order to be able to lay some plan of action. If we don't know what circulates in any of the fields that we're talking about, animal health, human health, or environmental health, we won't be able to predict anything or to prevent anything. So that's why I'm so keen on surveillance, so that we don't go towards this One Health approach without something grounded, something that we can touch upon, something that is based on data and facts. So we have sectors where we have better and more structured surveillance and better data, which can be improved, and others where it is less. So we need to improve that area. So that's why I do think that there is value on having data in order to be able to prioritize, because otherwise it becomes an expert opinion or an expert point of view, which might be biased when we prioritize on the background of the person, on the work that they've done. We need to be able to be a bit more objective in the way that we focus our work, and the only way in which we can do that is by having information.
Yeah. Yeah, well, also in the chat, people argue that in some cases we missed predictors of spillover events. Yeah, that's true. There are cases that we missed that, but we also could say that we have been better. That the research is helping to improve that, but it's still, yeah, it remains very difficult to predict new outbreaks. Osman, you would like to add something?
Yeah, I just wanted to add on the specific point about, better involving the environmental sector. I think part of it is to support what is already existing legislation and governance around the environmental sector. And part of that is just around enforcement. So if you've got a big project coming up and environmental impact assessment is a legally mandated process. You have to do it if you're building a new dam, or there's a new industry coming that's developing. You're going to be planting, I don't know, palm trees or some monoculture or something. You're supposed to have, or you're starting a new mining, a new mine somewhere. You have to do an environmental impact assessment. So enforcing that, having a particular set of quality standards around that, integrating health impact assessment into it, the risk of zoonosis or emerging infections into that process, is a good way of bringing in the environmental sector and giving them their due importance and significance within that space. And then, of course, alongside that goes all the monitoring and evaluation and surveillance that's required within the environmental sector. So I think empowering them a little bit through legislation and governance and improved enforcement of already existing rules and regulations is one way of doing it. And then, of course, also recognizing that, again, there's a step difference in the amount of investment, expertise, human capital that is put into the environmental sector versus the other sectors. And whatever sector you're from, you have to just acknowledge that. And if you want some sort of parity around it, you have to have a differential level of investment into it. It's, when we did stuff for, I'll just give you an example just to highlight how big the difference can be. This relates to the animal health sector, but when we were looking at the One Health platform and coordination in West Africa, in Sierra Leone, for example, there are only 5 public health vets, public sector vets in the whole country, 5 or 6 practicing vets. How can you expect them to work on zoonoses and human related diseases when they have a whole bunch of animal diseases that they also have to deal with? There's only 5 in the whole country. So the level of difference in resource and capital, experience, expertise, and investment is so vast that that has to be appreciated.
Yeah, and also the level in legislation is also so very different. But I understand the argument to include zoonosis as a risk in your assessments. I think that's really important to try to cope with zoonosis in an early stage. Casey, please go ahead.
Sure, thank you. I just wanted to address some of the points around community engagement and coordination as well in the chat and offer some additional examples. But with engagement, communication is a key underlying factor that's needed there. And one thing we do in the United States, we have a number of communication platforms for One Health partners from the various sectors. We have them focused for like national or federal level government officials. We have them for our state, tribal, local, and territorial partners who work in public health, agriculture, wildlife, and environment. We also have one that's basically for the public where communities and others can come and hear updates and ask questions and share information. So it takes a lot of time and energy to coordinate those, but I think an important key to success in One Health is over communication and ensuring that there are platforms available for people to come and address. And then also on the community engagement front and working with indigenous populations, we have a really great example from some work done in the Western United States, working with partners in tribal lands in those communities and developing a project called the Rocky Mountain Spotted Fever Rodeo to be able to address the emerging issue of the brown dog tick coming on dogs that were free roaming on reservations and the increasing human animal bond with those dogs going in households and sleeping there at night, and really bringing the community together to address the human health piece, increasing awareness in the healthcare providers, to address the animal health piece and having better husbandry for the dogs, addressing the vectors and the environment pieces as well, and really doing that in a good, strong community effort to help reduce the human disease, but also improving animal health and protecting the environment as well. Thank you.
Thank you, Casey. Very nice remark. Are there any other, Elsa, did you see other points to discuss from the chat?
I think we covered pretty much all the main points in the chat. There was a question which I would like to rephrase a little bit. So somebody was talking about past, I would say, prevention that have been successful. I was wondering if each of you could very quickly, I mean, you already gave quite a few examples, but we talk about evaluation of prevention success. How can we evaluate if prevention activities or some actions have been successful? Would you, each of you, could give us like an action of prevention, some activities that we could evaluate as really successful here, like past prevention activities that have been successful? I know, starting with Daniel, maybe.
Yeah, Elsa, I was just trying to think whether we can learn from the past. So, for example, I think not many people on this call received the smallpox vaccine. So, you know, if something like that, if we hadn't got the smallpox vaccine, what impact would that have had? So I think we need to do an analysis of trying to get a grip on the cost of not doing something, so that we can present that as evidence that prevention has tremendous value. I think we can. I mean, think about the COVID pandemic. That a lot of things went into preventing that, but we still lost about more than 7 million lives. If that had not been stopped, where would we be now? I think that analysis like those are needed for people to appreciate better the value of prevention. Yeah, thank you.
Thank you, Daniel. And Anna, could I give you the word for maybe an example?
Thanks. Yes, on those same lines of thought, I mean, it's not a zoonotic disease, but we don't have to forget that we also eliminated rinderpest. And we have to, in 2008, and we have to think about how we managed to do that, the different types of strategies that were used in the different continents, and particularly in the last mile, which was in Africa. There was a lot of participatory epidemiology that was used in terms of surveillance. It encompasses not all the sectors, but particularly the environmental and the animal production sector, and the livelihoods of pastoral populations. But I do think there is value in thinking about those success stories as examples of what we could do for preventing other diseases. I mean, in that case, it doesn't affect human lives, but it does have effect on human lives on a secondary effect, let's say, in terms of their livelihoods, because there's no source of protein. So these are success stories of prevention, and we should build on the experiences that we've had with those, and try to identify what were the key points that helped us get to that successful outcome. Over.
Yeah, there are some examples of eradication. Rabies was already mentioned. In Western Europe, we also have the eradication of bovine brucellosis, bovine tuberculosis by testing and culling. So these are prevention programs that have been successful. And indeed, I guess we should learn from those, and well, maybe be even more inventive to try to have our preventive measurements even earlier than the culling procedures. Are there any other examples that people would like to discuss? Daniel mentioned already the very interesting example of Rift Valley fever. That's also it's to a certain level successful, although not completely successful yet, but it is improving, I guess. If not, no. Are there any other, Elsa or Catherine, are there any other things? There are some new messages on the chat, I see.
I think Casey and Osman raised their hands. Maybe you have a final
to
add.
Osman, go ahead.
I was just going to share again, I suppose it's vaccine related, but it's more specific, and this is of Jakob Zinstag's and colleagues' work in the Sahel. But joint vaccination programs between animal and human health are one area where there's been demonstrable success, both in terms of raising immunization rates in both the animal populations as well as the human populations, but also that in that they're focused and framed around hard to reach groups, pastoralists, nomadic communities, where they traditionally you have very low immunization rates amongst the children, and we're actually counterintuitively you often have higher vaccination rates in the livestock population, in the animal population, because the communities are so dependent on their livestock for everything from nutrition and food to livelihoods. The vaccination rates are actually higher in the animals than in the children, and having these joint vaccination programs means you reduce costs, use the same cold chain, use the same infrastructure to transport the vaccine, and you run the campaigns together, so you can demonstrate the success, both in terms of process, cost savings, as well as vaccination rates and ultimately human and animal health outcomes. So that's a really good example of this.
Thank you, Osman. That's also a very good example of a One Health cooperation that is successful. And it also helps very much to raise awareness of people about a certain disease. So I think that's a very nice example. Well, I think we are coming close to the end. We had very interesting discussions about prevention. I think we can agree on the importance of prevention. It's clear from what we hear in the discussions that we really need to keep working on research and also legislation related to prevention. We have to improve our organization of prevention. Early start of One Health cooperations was mentioned several times, so that's interesting also to improve prevention. Also mentioned several times in the people seem to agree on it's very important to connect with the public, also to connect with important stakeholders, to raise awareness on all levels, and also to improve funding for our prevention implementation. So, well, I hope you've all enjoyed the discussions and learned some of the discussions. It was a pleasure to moderate such an expert panel. I think the people involved in the panel were real experts on prevention activities. So I would like to thank all panelists. I would like to thank also all people taking part in the discussions also via the chat. We have not been able to cover all questions in the chat, but I hope we have been able to discuss the main ones. So thank you, Elsa, and also Catherine, for looking into this. And I give the word to Elsa for a last word on closing the event.
Thank you very much, Wim. Thank you very much to our fantastic speakers. It was, I think I can speak for everyone, and based on the reaction in the chat, for this really, really interesting, insightful discussions. It was a great pleasure to be part of this webinar. I'll quickly give the floor to Catherine. So yes, and to more information regarding the next PREZODE webinar. Thank you again very much.
Yeah, thank you all. So as you can see, we are already planning the next webinar session on January 23rd. And we are looking forward to gather all the comments and great outcomes from this webinar to share it with you on our different communication tools. So thank you, everyone. Thank you, Anna. Thank you, Wim. Thank you, Osman. Thank you, Cassie. And thank you, Daniel.
Okay. Bye-bye.
Hi, thank you.
Yeah, it was a pleasure.
Thank you.
Thank you.
Thank you.
Bye.